Our emerging technology is smart inhalers. My name is Brandy Kaufman. I'm a health science major and I'm hoping to go into healthcare administration in the future.
My name is Mark Crate. I'm a health science major at the University of Florida as well, and I'm hoping to be a dentist one day. So, smart inhalers, one of the biggest communities that it helps is people with asthma, and one of the biggest and scariest thing for people with asthma are asthma attacks. So, as asthma attacks, basically, you feel like you're suffocating, and on a given day in the United States, 30,000 Americans with asthma could be vulnerable to having an asthma attack. And so basically what it could feel like is like you're like feeling through a straw, like someone's stepping on top of you. And these are just some quotes of how people feel with when they have asthma attacks. And so what we're gonna do is talk about smart inhalers and how it could help combat people with asthma and people experiencing asthma attacks.
A new and innovative solution to the problem of asthma attacks would be smart inhalers. They're inhalers with extra digital features that allow you to link to your phone or your tablet. An especially important unique feature of smart inhalers is their use of sensor technology, which is built in and helps record data about the time and date of use and the location of the patient at each use. This helps provide knowledge that can mitigate the clinical severity of conditions and help patients adhere to a strict medication schedule, hopefully to improve health outcomes in the future.
So how do they work? Um, Basically, what a smart inhaler does is that it's going to detect, record, and store object inhaler event data in the device. It's also going to measure inspiratory flow rates for the patient and detect how their lungs are being used. Thirdly, it's going to send reminders about device uses in hopes that it can increase adherence to the medication. It's going to give feedback on inhaler techniques for usage. So one of the biggest risks with inhaler use is that sometimes patients don't use the inhaler the right way. So the device is able to tell if they're using the medication the right way so they can get the full effect of it. And then finally, it's going to grant access to data via Bluetooth. So you'll be able to share your data to a doctor or you'll be able to view it yourself. So why are they exciting? We're about to tell you why. It's a big question.
So one of the reasons why smart inhalers are so exciting is because of the substantial target population that would be affected by its implementation. Some of the biggest beneficiaries of smart inhalers would be patients with asthma and COPD. Chronic respiratory diseases make up a little bit over 8% of the world's chronic disease burden. Asthma affecting 300 million people worldwide and COPD affecting over 200 million people worldwide. Asthma is currently on the rise in the US. So about 1 in 12 people in the US has asthma, or about 25 million people. From 2001 to 2011, over that period of 10 years, the number of Americans with asthma grew by 28%, according to the CDC. Finally, from 2001 through 2009, asthma rates rose the most among Black children, which is almost a 50% increase. And so that's a population we'll be looking out for in future slides, because it's important to look at to see who is most deeply affected by this increase in asthma prevalence in the United States.
So like Brandy mentioned, there's some communities that are more heavily affected by asthma. So this includes non-Hispanic Blacks, Hispanic and American, Indian, Alaskan Native people. So these groups of people have the highest rates of asthma, deaths, and hospitalizations. And so we think that smart inhalers could improve access to the medications needed and also improve adherence for them.
There are some studies that have indicated that long-standing health effects would be improved by the use of smart inhalers. So people with COPD who use the Propeller Smart Inhaler were significantly less likely to be hospitalized, with 35% reduction in the number of hospital visits compared to the year before. In addition, asthma patients who used the smart inhaler technology had a variety of positive health outcomes, including better medication adherence, fewer hospitalizations, and fewer doctor visits needed. Why that would be beneficial is the results are promising and suggest that smart inhaler technology can actually improve patients' health in addition to improving medication and adherence.
So another big risk of having asthma or COPD is air quality changes. So on the right, you can see the air quality index, and something like hazardous would be really dangerous to someone with one of these two conditions. And so what the smart inhalers could do is it could detect when air quality is bad and inform the patient to administer medication. And so this could be used in emergency situations where there may be a fire or volcano eruption. And it could also uh, uh, be beneficial for people in poverty, living in poverty, because it's been shown that air quality has been worse in poverty-stricken areas.
And finally, as we mentioned earlier, there's some important current research going on. But the smart inhalers is currently still being developed. So there is limited information in relation to the outcomes, but there are some important studies that have been done that I'll mention now. So a 2019 Cleveland Clinic study revealed COPD patients using smart inhalers showed nearly a 35% decrease in hospital visits as compared to the previous year. And a study in the Netherlands is currently being conducted that aims to explore the effectiveness of smart inhalers in asthma, evaluates its acceptability in use, and looks at the benefits it provides based on patient characteristics.
So in conclusion, we believe smart inhalers can be really impactful and improve the health outcomes with people with COPD and asthma in the United States and throughout the world.
Smart inhalers can be extremely beneficial for a large portion of our population by increasing adherence and access to the necessary medications, improving health outcomes for patients with respiratory issues like asthma and COPD. It could also drive down costs through emergency healthcare visits, which in turn helps drive down total healthcare costs for the entire United States.
Thank you for listening to our talk on smart inhalers, and these are our citations, and thank you.